where you just left with this degree of urgency, how do you balance the urgency of starting treatment with this shared decision making? And are there any tools or any tactics that you can share with the audience?
So first of all, I think being honest and having transparency with our patients, I always really try to aim to provide really clear, open communication about their diagnosis and summarizing their treatment options that were reviewed with them. I think, I'm sensitive, but I want to be really honest in explaining kind of the nature of their illness and really that urgency to start treatment. But like I said, I also want to give them space to be able to ask questions and express concerns. I'm also open about the advances in treatment associated with small cell lung cancer, with improved response rates and a variety of clinical trial options. I know Dr. Sands could probably speak to that even more, but I really do think it's important that we have these discussions with their patients, because it really is a different field now than it was even 5-10 years ago when patients are diagnosed with small cell lung cancer. And so I think it's really important to have a conversation with these patients about balancing treatment with their goals of care and really understanding what their goals are, what they find as kind of important to them, what's important to their family. But to be able to just speak with patients, it's not always like a tool, but just having a listening ear and letting patients ask questions and being with them to be able to answer all their questions that they have. I feel like that builds a very trusting relationship from the get-go, which I think is crucial, especially with this diagnosis when things can change pretty rapidly.
Thank you so much. Yes, Dr. Sands.
Oh, I mean, to that point, the two visits can be very, very helpful. Where when I'm talking with patients, I will often call out. I mean, frequently I can tell, like, hey, someone they lost the whole information we're discussing. Like they went into their own head. It's natural. The situation often just feels surreal with people. They were fine, and now all of a sudden they're in an oncologist's office talking about having small cell lung cancer. It's disorienting. And I'll often acknowledge that for people. I'll say to them, hey, I usually find that people just feel the room spinning around them in the middle of a discussion like this. And if you feel that way, it's totally natural. And I'll often say that when I can see that someone has lost me, or it doesn't seem like they're tracking everything I'm saying. And usually people will say, yeah, I don't know what you said. But I think in doing that, my goal is to essentially relieve any pressure. Like, hey, if you're not catching everything I'm saying, it's okay. We're going to come back to it because you're at the center of all of this. And I'll call that out sometimes when discussing treatment options as well. I'll call out common misconceptions. I'll go, oh, people usually come in here thinking that if they get chemotherapy, that means they're going to be laid up in bed vomiting without hair. And almost always people go, doesn't it? Thankfully, nausea is not nearly the problem it used to be. The first line regimen for small cell lung cancer, people do lose their hair. And I try to really be very upfront about the things I expect, but also being very upfront about the things I don't expect. So, yes, they can happen, but I don't expect that. And people often come in thinking the worst of everything, that a lung cancer diagnosis means that at any moment they can just drop dead, and any treatment is just going to cause a whole bunch of toxicity. And thankfully, that's not actually the equation. And if that were the equation, then being an oncologist would essentially be torturing people. And that's a horrible job. And we wouldn't do that. That the goal in all of this, from the beginning, most people want to be very clear. Their goal is prolonged quality of life. And so I will frame the discussion around that goal and make sure that we're on the same page about the reason that we're doing any of this, the reason we're discussing it, and also making it very clear that they have a choice in all of this. But I think some of that is also framing it in a way that feels right, where it can be hard sometimes to make a decision. And I'll say it's normal to not be sure what to do sometimes, because there is not an option here that's appealing. There is no option that's like, oh, that sounds great. we're choosing between two things we don't want. So let's kind of anchor around what is going to drive those decisions. Now, usually for the first treatment, that's not such a dilemma. I mean, this is an aggressive cancer that the first treatment often works great, and it has the real potential of working for a very long time. I mean, this is wonderful. Our first line treatment really is very effective. And it's exciting that we do also now have other often effective treatments that we can discuss. And so I know we'll kind of get to that a little further down the line, but essentially what I'm highlighting is anchoring around what the patient is emotionally experiencing, because we all know it's tough. Like, we work in an intellectual space, but we all live our lives in an emotional space. And so that's where there can really be a big disconnect. If we're just talking, like computer, but people are living their lives emotionally, and you flip the script, and all of a sudden the healthcare practitioner is the one that's disoriented. If it's like our own lives that someone else is interacting with us. So I think we have to be attentive to that, and kind of, what are the beliefs coming in? Okay, what is the reality of those, and how much of a factor, and how much do we really expect in all of this as a way of balancing this out? Now, that being said, even with all that effort, the room spins around people. And so for them to then have a separate visit with Stephanie, where she's going to go through things in a different way, and then that ends up being another way. Like, okay, they got all that. They've maybe processed some of that. It's impossible to process everything, but some of that, and now they're meeting fresh again and going to go through things in a different way. Then I think people retain quite a bit more. It's also really important because Ms. McDonald and them are going to interact a lot as well. We're a care team, and so I often say to them, hey, I really want you to meet her, because she's an important part of the team too, and that way she knows you, you know her, because we work together.
I really appreciate how both of you really focused on humanizing the patient and normalizing the overwhelm and the confusion and all of the emotions that go along with a new cancer diagnosis.